All right, let's talk about that complete blood count report. You know, the one you get from your doctor. We're going to crack open one of those mysterious three-letter acronyms that you've probably just glanced over, but actually hold some pretty fascinating secrets about your health. You've totally been there, right? You're staring at this page just full of numbers and letters. PLT, MPV, and then PDW. What in the world is it? Why is it even on there? Well, today we're going to find out. So let's start digging. Okay, so first things first. What exactly is this clue that's just hiding in plain sight on your blood work? So PDW stands for platelet distribution width. Now, right away, this is not about how many platelets you have. That's a whole different number, your PLT count. Instead, PDW is all about the variety in the size of those platelets. It's basically asking, are all your platelets pretty much the same size, or do you have a real mix of big ones and small ones? I love this analogy. Think of your platelets as your body's own little 24/7 emergency repair crew. The second you get a cut or an injury, they just rush to the scene to form a clot and stop the bleeding. They're amazing. But here's the thing, this repair crew isn't a uniform squad. And PDW is just the measurement that tells us if we've got a team of all similarly sized workers or a really diverse crew with big, small, and medium-sized members. And you know what? That diversity is totally normal and expected. Platelets have a really short lifespan, only about 5 to 11 days, so your body is constantly making new ones. The brand new ones, the young platelets, are usually the biggest. The mature platelets, the ones doing most of the work, are kind of in the middle. And the old ones, getting close to retirement, they're the smallest. So a healthy blood sample will always have this mix, and PDW is just the number that measures that natural variation. Okay, so if some variation is totally normal, how much is the right amount? Like any good investigation, we've got to establish a baseline. What are we looking for? For most labs, that normal healthy range for PDW is going to fall somewhere between 10 and 18%. Now, it's super important to remember that this can change a little bit from lab to lab depending on their equipment, so always check the reference range that's printed right there on your own report. All right, so now we get to the really interesting part. What does it mean when that number is higher than the normal range? Let's follow this trail and see what that clue might be trying to tell us. So, the technical term for a high PDW is platelet anisocytosis. I know, it's a mouthful. But really, it's just a fancy way of saying there's more variety in the size of your platelets than usual. It's a signal, a little flag that says, hey, the body is either churning out new platelets really fast, or the existing platelets are getting activated and changing shape because of something. So what's causing this? Well, a lot of the time, it's actually something pretty ordinary. This study here does a brilliant job of showing the most common reasons for a temporary spike. Look at this. The top cause at almost 35% is just the body recovering from an illness or maybe a vitamin deficiency. Iron deficiency anemia is also a really big one. Basically, your body is just ramping up platelet production because something's going on. So here's the crucial point to understand. PDW is a really good marker of what's called platelet activation. When your platelets get called to action by something like inflammation, they literally change shape. They go from this smooth little disc to a spiky sphere with these little arms, which changes how they're measured. So you can think of PDW as a kind of inflammation indicator. And because we know chronic inflammation is a driver of a lot of serious conditions, researchers have found that a persistently high PDW can be linked with long-term risks, like cardiovascular disease and even some types of cancer. In fact, this isn't just a small-time clue. Its potential is so significant that a major study from the NIH came to this conclusion. In a hospital, a high PDW when a patient was admitted was a powerful predictor of a tougher clinical course and, pretty soberingly, a higher risk of mortality over the next 3 months. Okay, now I know that sounds pretty alarming, but listen up because this is the single most important part of this entire explainer. A single clue is never, ever the whole story. We absolutely have to put it in perspective. And this slide just lays out the whole challenge perfectly. On one side, yes, a high PDW can be a flag for serious underlying issues, for sure. But on the other side, it's a super sensitive marker that can be nudged by dozens of completely harmless everyday things. Did you have a really tough workout yesterday? Your PDW might go up. Are you pregnant or on your menstrual cycle? It can go up. Even a tiny bit of inflammation from something as simple as a cosmetic procedure can affect the result. This is exactly why doctors almost never look at PDW in a vacuum. I love this quote from Dr. Evgeny Zaitsev, a specialist in lab diagnostics. He basically says if your main platelet count, your PLT, is normal, a high PDW all by itself is generally considered to have, get this, no clinical significance. It's just one piece of a much, much bigger puzzle.
So, after digging through all the evidence, what's the final verdict here? What are the key things you should walk away with from our little investigation today?
Let's break it down into 4 simple steps. Your PDW takeaway plan. Step 1, remember, PDW is about the variety of platelet sizes, not how many you have. Step 2, a high number is a clue that platelets are being activated, but it is not a diagnosis. Step 3, context is everything. Your other blood markers, especially that total platelet count, and just what's going on in your life. All of it matters. And number 4, and this is the most important, your doctor is the lead detective. They're the only one who can take all these clues and figure out what they mean for you.
And that brings us to a really cool final thought. PDW is part of a routine, super cheap blood test that's done millions of times a day all over the world. As we get smarter about understanding the subtle patterns in these simple data points, could they become these incredibly powerful, low-cost tools for predicting and monitoring our health risks way earlier? It's a pretty fascinating question for the future of medicine. Thanks for joining me for this explainer.